My name is Jeneice Miller. I'm an advanced practice nurse at Norman Regional. As a nurse practitioner, I had started out in orthopedics, which is a specialty in surgery as well. And then I met Dr. Rabel, and she had a specialty in breast. And so I became interested mostly because of the surgery part of it and taking care of those surgical patients. I got interested in genetics because she asked me to. It was right at the time that starting to test patients who had breast cancer for genetic mutations, and she asked me if I would start doing that. I've had specialized training, certification, and I love to be able to tell patients there's a reason for the cancers that they have and things that they can do to modify those risks. I've always been interested in taking care of others. It was really unusual that I became a nurse because I went into pharmacy first, and when I was in school, I had a lot of exposure to nurses, and really they were the ones that talked me into becoming a nurse. But I was interested because there are so many different fields that you can go into as a nurse. I started working with Dr. Rabel in 2009 at the Breast Care Center over on Porter, and I worked with her until 2011, and at that time Dr. Chase and Dr. Isabel became the providers at the Breast Care Center, which I worked with them. 2015, I went to work with Dr. Rabel again at Integris, and again, we both decided that this is a better place for us. Being able to provide care in this community, I, again, have been working with Dr. Rabel in North Oklahoma City, and I live in Blanchard, so this is going to let me provide care to people that I know in my community a lot easier. We have a farm, and so I wouldn't say it's necessarily always fun, but we're usually working on the farm, taking care of the animals. We have lots of new babies out there, so it's always a challenge. But that's what I would say I do for fun. Other than that, going to movies, which is very few and far between. I like to travel, but now that we have this farm, sometimes it's a little challenging trying to get someone to take care of all of these farm animals. I would probably be some kind of a computer programmer, which I'm really not that great at computers, but I've always been really interested in it. But if I was not a nurse practitioner, I'd probably get into computer programming.